Ouch, you've cut yourself and you stick a Band-Aid on the cut and the bleeding stops within minutes. What just happened? It's called coagulation, the process of thickening the blood to produce a clot. Vitamin K is a main component of this process. Hi, my name is Susan and I'm doing this presentation on vitamin K for my Nutrition 101 class. Vitamin K is a group of compounds or coenzymes known as vitamin K1, which comes from a plant, vitamin K2, a bacteria source, and also the synthetic source known as vitamin K3. Vitamin K activates the calcium binding of 4 of the 13 proteins that are needed to clot blood, strengthen bones, for cell growth and nervous system development and maintenance. Vitamin K is a fat-soluble vitamin, so it is able to be stored in the body for future use. And the excess stores are also able to be excreted, although minimally, through the large intestine. Because of this, there is a reduced risk for deficiency and toxicity, and so there is no recommended daily allowance. An adequate intake level for vitamin K is in infants. They do require 2 micrograms in order to prevent deficiencies. Women 19 and older require 90 micrograms, and men require 120 micrograms. Although rare in adults, deficiencies can be found in people with malabsorption issues of soluble fats. These would be Crohn's disease, celiac disease, the long-term use of antibiotics, which kill the intestinal bacteria that produce vitamin K, and also warfarin patients who are on warfarin because of heart disease have to closely monitor their levels of vitamin K and probably counteract the warfarin blood thinner with synthetic use of vitamin K. The symptoms of deficiencies in adults are bleeding from the gums, unusual bruising, and prolonged bleeding from cuts. Newborns are at a risk at birth due to the lack of intestinal bacteria that produce the vitamin K. And in the U.S. it is common practice to give a vitamin K injection to newborns at birth. In underdeveloped countries where medical treatment is not always available, there is a 20% death rate. And this is mainly due to the lack of intestinal bacteria at birth. Symptoms in newborns are bruising, bleeding from the umbilical cord or from the intestinal tract. Recently, there has been a link of an increase in hip fractures in older adults due to the lack of vitamin K, which can easily be corrected by either eating more green leafy vegetables or using the synthetic version. Again, toxicity is rare, and it's only found with the synthetic form K3, and most commonly in heart disease patients who are taking warfarin. The food sources for vitamin K are green leafy vegetables, mostly spinach, broccoli, and kale, beans and soybeans, strawberries, eggs, and meat. Bacteria in the intestine produces a small amount of vitamin K, and then again there's a synthetic form. So how is that cut? The bleeding has stopped and the healing has begun, all thanks to vitamin K. This essential vitamin can be found at your local produce stand in the form of dark green leafy vegetables. Pick some up today. My references are WebMD, the Arizona State University School of Life Sciences, the Nursing Reference Center database from the Renton Technical College Library, and the Harvard School of Public Health website. Thank you and have a good day.